So in this video, I'll be talking about neuroanatomy of urinary bladder. So you're coming to the urinary bladder anatomy. It is 4 parts, which consist of apex, base, superior surface, and inferolateral surface. This is the base. This is the trigone of the bladder. This is the apex. This is the downward part, and the inferolateral surfaces. So coming to the neurovascular supply, the bladder is supplied by internal iliac artery, which gives superior vesical artery and the inferior vesical artery. It is drained by the vesical venous plexus. Coming to the nerve supply of the bladder, it consists of pelvic splanchnic nerves, which consist of hypogastric plexus L1 and L2, L1 and L2 inferior hypogastric plexus, and S2, S3, S4, the pelvic splanchnic plexus. So filling beyond 220 ml causes micturition. Emptied when filled to about 250 to 300 ml. Filling up to 500 ml may be tolerated by a patient, but beyond this it is very painful. Referred pain. Pain is referred to lower part of the abdominal wall, perineum and penis. The nerve supply being T11 to L2 and S2 to S4. The parasympathetic supply of the bladder is S2, S3, S4. The sympathetic supply come from inferior mesenteric ganglion is L1, L2, L3, and S2, S3, L4 contains the somatic or voluntary control of the bladder. Now, parasympathetic system will cause micturition. And sympathetic system will prevent micturition and will relax the bladder. So coming to the micturition, the sympathetic nervous system causes filling of the bladder. It prevents micturition. So it will cause relaxation of the detrusor muscle and it will cause constriction of the internal sphincter. External sphincter is not supplied by the sympathetic plexus. The function of sympathetic plexus is filling of the urinary bladder. Now coming to the parasympathetic system will cause micturition. So to cause micturition, the detrusor muscle of the bladder should contract. So it will cause the contraction of the detrusor muscle. Sphincter should relax in order to urine to come out. So it will cause relaxation of the sphincter. It will cause emptying of the urinary bladder. The somatic nervous system does not supply the detrusor muscle. It does not supply the internal sphincter. It causes constriction of the external sphincter. So it will prevent micturition. So the somatic system is under the voluntary control. So the sympathetic and the parasympathetic system does not supply the external sphincter. This is a very important point. But the voluntary control of the bladder is due to the somatic nerve supply, not the sympathetic or the parasympathetic plexus. So sympathetic and the parasympathetic system. Sympathetic system is supplied by the hypogastric nerves L1, L2, L3, which relay at the inferior mesenteric ganglion. It is motor to the internal urethral sphincter. It is inhibitory to the detrusor muscle. It has no significant role in micturition. Along with internal urethral sphincter, it prevents reflux of semen into the bladder during ejaculation. Now coming to the parasympathetic system. Parasympathetic system is supplied by the pelvic nerves, that is S2, S3, S4. It is motor to the detrusor muscle. It is inhibitory to the internal urethral sphincter. The stretch receptors present on the wall of the urinary bladder sends the sensory fibers into the pelvic nerve, then relay in the intermediolateral column of the spinal cord. Parasympathetic nerves, it stimulates the muscarinic receptors and causes emptying of the urinary bladder. The somatic system, the pudendal nerves consist of S2, S3, S4. It voluntary control of the external urethral sphincter. This maintains the tone of the contractions of the skeletal muscle fibers of the external sphincter so that the sphincter is contracted always. During this micturiation, this nerve is inhibited and there is relaxation of the sphincter and voiding of urine. Sensory supply of the bladder is hypogastric, pelvic and pudendal nerves. Cortical sensation or cortical control of the bladder is through this nerve supply. So coming to the control of micturition, There are three centers in the peripheral nerves. One is the cortical maturation center, one is in the pontine maturation center, one is spinal maturation center, and the peripheral nerves. I'll be discussing each one in brief subsequently. So the cortical maturation center, it is located in the paracentral lobule in the medial aspect of the frontoparietal cortex. If you don't remember this, just remember paracentral lobule and the frontal cortex. It is inhibitory to the pontine medullary center. So the function of cortical maturation center is it inhibits the pontine medullary center. Dysfunction will cause loss of social control of bladder. The brain's control of pontine medullary center is a part of social training that children experience in the age of 2 to 4 years. That's what voluntary bladder control occurs in children at the age of 2 to 4 years. Now coming to the pontine maturation center. The pontine maturation center is also called as Barrington's nucleus. Very important MCQ. It is located in the lateral region of the pons. The function is continence and storage of urine. Stimulation results in powerful contraction of the urethral sphincter. The medial region is the maturation center. The stimulation results in decrease in urethral pressure and silence of the pelvic floor EMG signal followed by rise in detrusor pressure. So, the lateral region is responsible for continence and storage of the urine, and the medial region is responsible for the maturation. This is the pontine maturation center. So now coming to the sacral reflex or the sacral primitive maturation center, which is known as sacral maturation center or which is also known as the primitive maturation center, which first consists of sacral parasympathetic nucleus from S2 to S4, which consists of pelvic splanchnic nerves, somatic onymphoid nuclei, which is collection of external urethral sphincter motor neurons, consisting of levator ani motor neurons. Maturation reflex consists of filling of the urinary bladder followed by stimulation of stretch receptors on the bladder wall, which stimulates the afferent impulses which pass via pelvic nerve, which goes to the sacral segments of the spinal cord. Then from the sacral segment arises the efferent impulses via the pelvic nerve. There is contraction of the detrusor muscle and relaxation of the internal sphincter muscle. So there is flow of urine into the urethra and stimulation of the stretch receptors that then which stimulates the afferent impulses via the pelvic nerve. Then there is inhibition of the pudendal nerve which causes relaxation of the external sphincter and there is voiding of urine. So this is the voluntary control of the maturation. So overall this is the maturation reflex. So what is neurogenic bladder? Neurogenic bladder refers to dysfunction of the urinary bladder due to disease of the central nervous system or peripheral nervous system involved in control of maturation. So there are 5 types basically of neurogenic bladder. Uninhibited bladder, it is a cortical sensation, cortical bladder. Reflex bladder, the spinal cord above the level of S2. Autonomous bladder, it is at S2, S3, S4 level. Motor atonic bladder, it is the disease of the motor efferents. Sensory atonic bladder, it is the disease of the sensory afferents.